everyone, my name is Ariana Spell and I'm the Outreach Coordinator for the New Hampshire Insurance Department. This presentation webinar today is about how consumers can access behavioral health care services using private insurance. This is just some background information about the Insurance Department. It was established in 1851 and was the first insurance regulatory agency created in the U.S. And our mission is to promote and protect the public good by ensuring the existence of a safe and competitive insurance marketplace. We regulate all the insurance companies that are operating in the state as well as all the agents and adjusters. Our jurisdiction is limited to fully insured plans. We do not regulate self-funded plans, but we do operate on a no wrong door policy. So if someone has a question about their coverage and they reach out to us, we can point them in the right direction regardless of their source of coverage. Our department informs legislators and influencers, but we do not legislate ourselves. And we are part of the National Association of Insurance Commissioners, which we refer to as the NHID. And this is a group of states across the country that all collaborate together on insurance regulation. Just a few units within our department that are particularly focused on this issue. The first being financial regulation, which ensures that all of the carriers that are operating in the state are financially solvent, which means that they are financially well and healthy, that they can pay out claims as needed. Our compliance unit reviews all of the insurance forms that are submitted, so all of the plans that a company wants to sell. The details of those are submitted to the insurance department, and our compliance unit goes through them with a fine-tooth comb and makes sure that all of the information that contained within those policies adheres to New Hampshire laws, rules, and regulations. Our market conduct team looks at how consumers are being treated in the market, and so they can actually go to an insurance company and ask for all of their records and look at how members, consumers are being treated by that company, and seeing if there are any discrepancies between how consumer might be treated on paper when the compliance unit reviews it versus how things actually play out in the market when someone has purchased a plan. Our Consumer Services Division has a phone number, email address, fax line, and consumers can reach out during our business hours with any questions, complaints, appeals, and grievances. And those folks that are working in consumer services can also help people with the appeals forms and process, which we'll get into later. Our audience for this presentation has been providers, family friends, advocates, recovery support staff, and anyone else who can help someone in a crisis. We understand that someone who is in a behavioral health or substance use disorder crisis may not be able to implement the information contained in this presentation, but we hope that the people who surround those individuals may hear this information and know how to step in and help as needed. So some background. The access to behavioral health and substance use disorder services has really expanded in New Hampshire in recent years, and that's due in two parts. One, to the Affordable Care Act, which is now the services are a required benefit under that law. And the second being the New Hampshire Health Protection Program, which is the Medicaid expansion in the state. There are a lot of low-income individuals who are now able to obtain plans on the private market and have access to these critical services. So what is Parity? Parity is a bit of a buzzword, but what it means is that if a plan covers behavioral health and substance use disorder services, it needs to cover those services in a way that is comparable with its coverage of medical and surgical services. So here are some classification examples of behavioral health versus medical and surgical. So for an example, say for an outpatient visit, we would look at the parity equivalent of a psychological visit under behavioral health might look like a primary care visit to a primary care provider if someone has the flu or for a sick or injury visit. There are two major categories of barriers that someone might experience if there's a parity violation with their coverage. And one is a quantitative treatment limitation. So that means that the plan's out-of-pocket expenses, like the deductible, copayments, and coinsurance, or the number of visits or the number of days for treatment are limited, could be limited more stringently than they are for medical and surgical services. So a plan can have separate quantitative treatment limitations that only apply to behavioral health and substance use disorder services. Our compliance unit reviews all the plan filings for this information before they can approve to be sold on the market. So this is an area where the law is really clear because it's numeric-based and it's easy for us to enforce. The second major category would be non-quantitative treatment limitations, and this is how treatment is accessed and under what conditions. So the New Hampshire Insurance Department enforces non-quantitative treatment limitations through our market conduct exams. So those market conduct teams can actually go in and look at how consumers are treated in real life versus how the policies might appear on paper. Sometimes there can be some confusion around interpretation. And so it allows the insurance department to take a collective look at insurance records and look for specific trends. So what are some examples of non-quantitative treatment limitations? Some might be a fail first requirement or step therapy for different types of treatment, that a prescription drug formulary design is organized so that certain medications that are required are placed in higher tiers so that they're more expensive and people can essentially be priced out of purchasing those necessary prescriptions. That the standards for provider admission to participate in the network would be different or more stringent for behavioral health and substance use disorder providers. There might be exclusions based on failure to complete a course of treatment. That means that if someone is in a treatment episode and they are not getting better or not seeing any marked improvement, that the carrier cannot refuse a second course of treatment based on failure to complete the first. And also medical management standards like limiting or excluding benefits based on medical necessity or medical appropriateness. And this is not an exhaustive list. There are more non-quantitative treatment limitations that can be included in here. And I think that there are more that are being found by the state as well as being found nationally. So here are just some examples of red flags and things that I had referred to earlier. So these are different types of scenarios that if you think that this is happening to you or your patient or someone that is in your family or a friend, these examples are things that you might want to think about reaching out to the insurance department about, so that way we can help navigate their treatment and make sure that people are getting the services that are required under law and under their specific plan. So what if someone's treatment is denied? We want everyone to know that patients always have a right to appeal their denials. They will obtain a copy of their denial letter when the services are denied that will be sent from the insurance company, and it includes why the service was denied, which medical professional at the insurance company conducted the review, what the member's appeal rights are, and patients can give providers written consent to talk to their insurance companies on their behalf, and we'll get into that a little bit more. So there are a few steps involved in the appeal process. The first would be an internal appeal. So a different decision maker, medical provider within the insurance company would look at the decision that was made by in the first instance. Insurance company must make their decision within 30 days from the appeal request, and consumers have 180 days to file an internal appeal from the date of the denial letter. The second step would be an external appeal. So if the internal appeal was not successful, the next step is external. And this is overseen by the New Hampshire Insurance Department, and we will work with an independent medical review expert who will look at the insurance company's medical necessity determination. And consumers have 180 days to file an external appeal from the date of the denial letter, and the external appeal timeline is about 60 days. There are also expedited appeals. So if treatment is urgent, a consumer can file an expedited appeal, and the insurance company needs to act within 72 hours of receiving that request. In a very urgent situation, external and internal appeals can occur simultaneously. So providers assisting patients, again, patients can give providers written authorization to talk to their insurance company on their behalf. A provider could talk to the insurance company about this and get a form to sign off on. And providers can also contact Consumer Services Division on the patient's behalf. So here's some contact information about our Consumer Services Division. We also have a link to the external review form, which can be found on our website. We're also interested in hearing from medical providers about larger trends that they're experiencing, so it may not be related to a specific individual patient's issue, but it could be a larger trend, like, you know, ABC Insurance Company is always, we're always having challenges around this specific diagnosis code. Those are types of things that we want to be aware of. We're collecting that information, reviewing it on an ongoing basis. It may help us. It may help inform future market conduct exams that we do. Providers may not hear back from us about a resolution right away, but we do collect that information. And another critical point to get across is that the insurance department does not regulate contracts between providers and insurance companies. Those are private business contracts. Here's some of our larger efforts on the behavioral health and substance use disorder crisis in the state. We have a Behavioral Health and Addiction Services Advisory Committee. Those meetings are about every 6 weeks. They're open to the public. The information is available on our website, and we welcome anyone to participate in those meetings. We have performed some market conduct exams specific to substance use disorder services, and we will be doing more in the future. We have an analysis of SUD insurance claims data, which can be found on our website. We have a document about provider guidance, specific steps that providers can take to assist patients with behavioral health insurance issues. And we're also participating in the SAMHSA Parity Academy along with about 20 other states across the country. And we're sharing our resources and information with them. They're sharing information with us, and it's just a collective learning effort so that we can all be better about this issue of protecting consumers. Some more information about Parity if someone is particularly interested in diving down into the specifics. The U.S. Department of Labor is a great resource. The Legal Action Center has a great guide to Parity. New Futures and UNH Institute for Health Policy and Practice has an excellent navigating treatment guide, as well as the New Hampshire Providers Association, which is a great resource for providers. So just some key takeaways. Parity does not mandate coverage of behavioral health and substance use disorder services. The Affordable Care Act does that. That's part of one of the 10 essential health benefits that are required for minimum essential coverage. Parity does require plans to cover behavioral health and substance use disorder services in a comparable way to its coverage of medical and surgical services. Patients always have a right to appeal denials, and providers can assist with written consent. And we would like all problems to be reported to our Consumer Services Division. Here's some information if someone is in crisis. Thank you. And if anyone has questions, please feel free to email us or call us at any of this contact information, and we're happy to talk to you more in detail. Thanks very much.